again, in your perfect world, how is the patient coming in optimizing their TMS experience? What habits, what mindsets, what thought processes, changes in behavior, right? What are you looking for in your perfect world?
Yeah, that's a good question. I think patients who are already invested in their physical health are good candidates. Patients who are already exercising, they're eating well, they're maybe meditating, doing some breath work, working. They're really, really engaged and actively involved in trying to better themselves. Those are the best patients. I think getting therapy in conjunction with TMS is really important, especially with some of the more severe disorders, with severe depression and severe anxiety and PTSD especially. What we find is when people go through an intense TMS session, they get this bubbling effect of stuff that comes up from their past, kind of unprocessed trauma, which I'm sure you've seen a lot of. And so what that does is bringing it all up to the surface, and you do have to reprocess it, and hopefully in a more positive way. And sometimes, oftentimes therapy is needed to help you get through that. So in our severely depressed patients and our PTSD patients and some anxiety patients, we require them to have a therapist before they even start TMS.
Oh, wow. Okay.
Yeah. So we want to make sure that they have a whole network of resources and support. And we do a lot of follow-up, but we don't provide therapy. So we want to make sure they have that.
So now let me ask you this. Somebody coming in that can't get off the couch, their diet is shit, it's been shit, right?
That's most everybody. But
I know.
That was the ideal person I just described. They're not real.
So now let's switch it, right? Somebody that's coming in and they've been on the couch watching Days of Our Lives every day, eating cartons of ice cream. They still need TMS.
Yeah.
How are you coaching them? Right?
Yes.
What are you trying to get to with them?
Yeah. So for them, it's, more smaller incremental changes that we're aiming for. We do have a team of health coaches in our office that help support those patients that need an extra boost. They'll go on, especially if they're doing some of the longer TMS treatments. And when we used to do the 5-day protocol, they would take them out on walks in the middle of the day and help get them motivated, do journaling exercises, all kinds of things to help kind of boost their mood and get them more engaged in some of these complementary modalities to help. Yeah,
because that's my thing. I mean, most people, that's how they come.
Yeah.
Right.
Yeah.
I'm broken. Fix me.
Yeah.
Right. It's about setting small, daily, achievable goals. That's the number one thing.
Exactly.
That's for me. I'm got to start somewhere.
Yeah.
We'll get you there. Diet, exercise, obviously sleep.
Yes.
Hit those 3 and we'll keep that ball rolling, right? And we'll get you there.
Yep.